Hello friends. Today we are going to discuss about World Immunization Week. This year theme is For Every Generation, Vaccines Work. Let's discuss about this theme, my dear friends. When it is observed, why it is observed, and how this World Immunization Week is celebrated and observed, and what is my role and your role. Let's discuss about this important topic. I am Dr. Suresh Badadmat, Professor of Psychiatry, working at National Institute of Mental Health and Neurosciences, Bangalore. World Immunization Week. This is observed on the last week of April every year. That is, from 23rd April to 30th April. And every year there is a theme. This year theme is For Every Generation, Vaccines Work. What does it mean? Usually the vaccination protects an individual. But here we are talking about for every generation, vaccines work. What does it mean? This theme clearly reminds that vaccination is a powerful reminder that immunization is not merely a medical intervention for an individual, but a persistent, intergenerational shield that protects the collective future of humanity. What is this humanity? In simple word, my dear friends, we are able to do immunization to the whole world with regard to smallpox, and we are able to eradicate it. That means in future generation also are shielded against the smallpox, and we do not do any vaccination regarding smallpox at this point of time. That means this theme reminds us very clearly it's not only for the individual, not for just for the family, not for the community, to the entire globe, and also the future generation, my dear friend. That is the theme of this year. Let's understand why this Immunization Week is observed. Historically, this week was evolved from earlier regional vaccination initiatives which was started in US. It was started somewhere in 2003. It was to have a regional vaccination drive in and around America and also in South American countries. Slowly, the World Health Organization endorsed regarding immunization in 2012 through a World Health Assembly, my dear friend. The aim of this Immunization Week was to unify global efforts under a single coordinated platform to eradicate certain very important public health diseases, my dear friends. In this regard, World Health Organization from 2012 started observing World Immunization Week every year. Last week of April it is observed. If you look at the past themes, in 2025, the theme was Immunization for All is humanly possible. This was a simple theme to remind, yes, a collective effort can eradicate some illness. Simple word is this, humanly possible. To eradicate polio, a collective effort brought in, and we are at the edge of eradicating the polio, my dear friends. In 2024, humanly possible, saving lives through immunization. Again, it focuses on how to save life. In 2023, big catch-up. Because of COVID, there were many children who are left behind, and they were not given immunization. Hence, in 2023, the focus was on to catch up for those children who were not immunized. In 2022, long life for all. This is again from the vaccination perspective. And in 2021, Vaccines brings us closer. This is during the pandemic, my dear friend. We have seen COVID vaccination and how the various countries played a role, how certain socialistic countries shared vaccines, some capitalistic countries tried to make money by bringing in various vaccines. Although immunization is very important, some of the countries will make money and some of the companies will mint money. But socialistic countries play an important role in preventing death. In simple terms, my dear friend, the best would be oral polio vaccine, which was given free of cost to everyone across the world, brought down the polio remarkably, my dear friends. Now let's understand what are the objectives of World Immunization Week. It promotes equitable access to vaccines. As you know, in COVID, only the rich people were able to get access to the vaccines, especially COVID vaccine. But this World Immunization Week, through World Health Organization, promotes equitable access to vaccines, and it also counters the vaccine hesitancy and misinformation. As you know, there are many public figures, because of malicious intent, because of ignorance, because of cultural and religious issues, will bring misinformation regarding vaccines. Not even a single vaccine which was accepted easily. Many of the public at large, many of people who are influencers, bring misinformation regarding vaccine. Hence, World Health Organization wants to bring the information, scientific information to the public at large and counter the vaccine hesitancy. And it also highlights the lifespan immunization. We talk about immunization only for the children. But now we are very clear, vaccination is required across the age group for various illness based upon the risk involved in an area or geopolitical places where certain illnesses are very well known. Further, to support national immunization program and policy prioritization with regard to immunization is the important objective of World Health Organization, so that World Immunization Week is observed. As I mentioned, in 1974, over 154 million lives were saved since the launch of expanded program on immunization. And in 1980, smallpox was eradicated from the globe, my dear friend. This was possible simply because of immunization. In the present day, the polio is at the brink of eradication. This could have been possible only because of immunization. Otherwise, we would have been seeing the clusters of outbreak here and there. The combined effort of every citizen, every country, World Health Organization played a crucial role in bringing down smallpox and polio, my dear friends. If you look at the breadth of immunization, at present, 30 life-threatening diseases and infections have vaccination available, my dear friends. That means we can protect the global citizens by immunization against the 30 dangerous infections, my dear friends. Now let's look at the importance of immunization. By doing this immunization, we can strengthen the primary healthcare delivery and we can focus on prevention aspects. Everyone knows prevention is better than cure. Immunization is one of the best strategy for prevention and important weapon in public health policy and preventive measures. Further, by immunization, we can bring in herd immunity. Once the herd immunity comes in, the weaker people, the people who are not immunized, the people who have human deficiency syndrome like AIDS can be protected through herd immunity. Further, immunization reduces healthcare cost and economic burden. Further, this immunization acts as an entry point for integrated health services, both for maternal, child, nutrition, surveillance, child health related services delivery, my dear friends. So, immunization gives various parameters for a public health delivery and for a policymakers to focus on how to provide healthcare services. Please understand, immunization isn't just a health imperative, it is an economic one. The cost of inaction with regard to immunization costs 3.4 billion just in 4 countries, my dear friends. Immunization and lost productivity also is very essential to know. Conversely, vaccines offer a massive return on investment, generating $54 in return for every dollar invested, my dear friends. How does it? By saving healthcare cost, by ensuring the kids are in the school, they do not go to the hospital because of the vaccination, immunization, they are protected, stabilizing the communities against the outbreaks, and having a stable community output with regard to economic, my dear friends. So that means immunization, the return on investment is 1:54, my dear friend. If you invest $1 in immunization, you can get back $54. That is the assessment by World Health Organization. In simple photograph, you can see the cost of infection just for 4 countries where immunization was not done, 34 billion, my dear friends. And you can say return on investment is $54 for every dollar invested in immunization. Further, World Immunization Week was simply instituted to address the persistent gap in vaccination coverage. Further, to reinforce immunization as a fundamental public health intervention. Despite major advances in vaccine technology, but vaccine-preventable diseases continues to cause morbidity and mortality, especially in low-income countries, my dear friends. We need to increase the vaccination coverage, prevent mortality and morbidity. The gap is huge, my dear friends. The vaccines are available, but the people who are not vaccinated are huge in number. At the same time, the zero-dose crisis is becoming a major public health issue, especially for children, for coverage of public health. Further, there is a huge threat with regard to pandemic or disease outbreak in every community, my dear friends. If you understand zero-dose crisis, it refers to children who have not received even a single dose of routine vaccine. Typically, to understand zero-dose crisis, it is focused on absence of first dose of DTP, my dear friends. That is vaccination regarding diphtheria, tetanus and pertussis. If it is not done, the numbers are considered as zero-dose crisis. It has emerged as a critical global immunization gap highlighted by both WHO and UNICEF. The zero-dose crisis is not merely about missed vaccination. It represents children left outside the system altogether. Not only health system, but also from the education, from the society itself, and also focusing on health or the policy issue focusing on children. Zero-dose children are not just unimmunized, they are the matter of systematic exclusion, my dear friend. These children often live in settings which are fragile, war-affected countries, conflict-affected countries, my dear friends. Simple examples: the children who are in Gaza, the children who are in Israel, the children who are in Ukraine, in Russia, where there is a war going on. Invariably, the huge amount of resources are pumped into weapons, not for child health or maternal health. There is no health without peace, my dear friends. The World Immunization talks about zero-dose children. That means If you are unable to vaccinate these children, that means they are excluded from all policy matters, my dear friend. Further, geographical isolation and urban slums also play a role for zero-dose children. Further, poverty, migration, marginalization, discrimination against children plays a important role with regard to zero-dose children. For politicians, children do not vote. Hence, they are kept outside the ambit of any policy, my dear friends. If you look at the mission Indradhanush, which was introduced by India in 2014 across various illness, my dear friends. This is a flagship scheme launched to accelerate full immunization coverage, 90%, targeting the hardest to reach zero-dose pockets, my dear friends. You can see the range of illnesses covered in immunization in India. It starts from diphtheria to hepatitis, my dear friends. These are all the illnesses which need to be immunized so that our children in India are protected. Hence, the massive coverage for immunization through Mission Indradhanush was launched. As I mentioned, it is a flagship immunization initiative of Ministry of Health and Family Welfare of India, launched in 2014. Its main objective is to rapidly increase full immunization coverage among children and pregnant women in India. It was designed as a focused campaign mode intervention to reach those are left out and drop out populations in India, especially children and women from tribal areas, remote areas, and those where access to healthcare is a big challenge. And Mission Indradhanush focused on reaching the unreached. Again, the huge challenges are remote rural areas. These are hilly areas, extreme distance, challenged rugged terrain, systemic strain on the cold chain. You need to carry the vaccines on your shoulder in the high mountain passes. You need to maintain the cold chain. And in areas, maybe in the islands, where you have to carry these vaccines, and reaching this population is extremely difficult. Providing immunization for these people who are highly required is important, my dear friends. Further, the barrier, especially in urban area, is access to these vaccination, the cost of vaccination, the cost of going to a doctor and getting vaccinated. Further, my dear friends, many of these people in urban area are marginalized, discriminated. Many a time they do not know what immunization schedule has to be given. So it's not only the access, even the socio, demographic, cultural, religious factors play a role in immunization gap. If you know, the challenges can be summarized in 3 C's. Complacency. In simple word, the measles are no longer a threat. So why should I give measles vaccine? And parents stop vaccinating, and suddenly there is a outbreak of measles in certain pockets of the country. Further, convenience. Many of them say the vaccines are not available and they are not there near my hospital. I don't have leave. My child is going to college or school and he doesn't have any problem. Why should I give? Many times they may also say our religious leader has told not to vaccinate our kids. Further, confidence with the vaccination program. Many of them, the misinformation that these vaccines cause impotency, sterilization, will cause severe side effect, and these vaccines are targeted against certain community. These kinds of mistrust grows and the confidence in this program reduces. So these challenges need to be addressed, my dear friends. Hence, World Immunization Week plays a crucial role in decreasing these misinformation. Now the question is, how does immunization work at public health level? If you know, the immunization is by giving a mug shot. That means you are designing a virus or maybe a bacteria which is not a complete pathogen, which is not going to increase mortality or morbidity. It is just a blueprint which is harmless, which is given to the body and train the body against certain viruses and bacteria to protect and train your immunity, my dear friends. Once our T cells are trained, we call it as memory cells. They remain in the body, and whenever there is a real infection occurs, these trained cells will attack those bacteria and viruses. That means it's similar like in country like India, where there are terrorists. We need to train our military, public at large, how to identify these terrorists. By giving immunization, by doing mock drills, we are training our public and also the military against these militants. That is what immunization does. So by doing this immunization, we can protect our body also. Then how it works at the public health at large? Herd immunity, my dear friends. Herd immunity is a population level protection which affects in an indirect protection is considered to susceptible individuals when a sufficient proportion of population is immune to an infectious agent, either through vaccination or prior infection. Invariably, it is better achieved through vaccination, my dear friends, because vaccination is an artificial way of inducing immunity by giving those viruses or bacteria which are half killed and training your immunity. This decreases mortality and morbidity. Herd immunity can be achieved once you immunize 95% of the population. I can show you in this diagram. The first diagram, there is a low vaccination. If you look at the blue circle, these are the people who have been vaccinated. The white people, there is a white circles, they are not vaccinated. Here there is a low vaccination, it is less than 50%. That means the virus spreads rapidly. You can see the red arrows where the virus is spreading. And this spreading can cause mutation in virus. And the people who are being vaccinated also can become susceptible, like in COVID, my dear friends. There are various strains we are seeing during COVID pandemic, my dear friends. Medium vaccination. When you vaccinate approximately 50%, you can see some of the people who are in between the vaccinated people are protected, but herd immunity is not there. Once you reach 95% of immunization, where the blue individuals who are being vaccinated, they can protect the people who are susceptible for infection. They may be who are not immunized, or these are people who have acquired immune deficiency syndrome, or the people who have immunity problem. They can be protected by herd immunity. That means it works as a public health policy also, my dear friends. Now, how immunization works at complete population. It is a life course immunization, my dear friends. Most of the healthcare professionals, doctors, nurses know about childhood immunization program like polio, measles, DTP, and various things. In adolescence, now HPV vaccine has come. This is a frontier for eliminating cervical cancer, my dear friends. It is given both in female children and also male. It is adolescents, my dear friend. HPV vaccine is advocated in many developed countries. Next comes is adulthood and pregnancy. Especially, my dear friends, tetanus vaccine, protecting both maternal life and also the fetus, my dear friend. And finally, the elderly with regard to pneumonia, influenza, RSV virus. By giving these vaccination, you can protect the elderly. That means immunization is a life course, not just for children. Now the question comes, what is the role of artificial intelligence in immunization? In simple word, AI will help us in digitally to innovate, to come up with a important vaccination. We can improve our vaccines We can do a digital logistics, how to send the vaccine, how to know where the vaccine is less. By using digital logistics, maintain the cold chain and supply. Further, precision targeting. Through AI, you can predict in which area of the country there will be outbreak, what kind of vaccinations or immunization has to be done in a vulnerable population in that area. That means AI also has an important role, not only in designing the vaccine, predicting the outbreak, and also in digital logistics of supplying these vaccines. Now the question comes, what are the ingredients of successful immunization program? There are three important. One is biological. That means designing the vaccine, testing the vaccine, looking for it doesn't have any major side effect. That is one. Second one is sociological. That means the trust in the community with regard to the immunization program, community engagement, educating the public at large, educating the influencers, leaders, so that they buy this immunization program, my dear friends. Technological. Delivery of this vaccination, how easy it is to give, maintenance of cold chain, and how to transport this. For a successful immunization program, the three gears, what I mentioned here, biological, sociological, and technological synchrony, which are aligned together, needs to work so that health for all can be done, my dear friends. So World Immunization Week focuses on policymakers to understand, yes, immunization works. It is a preventable measure. Hence, we can implement at the very cheapest cost or economical cost to the entire population. For healthcare providers to tell them, yes, immunization works. They need to engage the public at large, provide information, do social media campaign so that misinformation can be brought down. At the same time, for the individuals and communities to know about what are those immunization which is required in that specific community, and to bring awareness with regard to immunization. To conclude, my dear friends, this year theme for every generation vaccines work means vaccines are safe, effective, and essential for protecting people for all ages, providing herd immunity in the present and also for the near future plays a very crucial role. Not only it safeguards individual, the entire communities, nation, and the future generation. As you know, the immunization has saved millions of people over the past 50 years. It is not by just accident, my dear friends. It is a combined effort of every human being, every country, World Health Organization, and scientists getting together and eradicating various illnesses. Immunization for all requires synchronized effort between biology, technology, and society. Let us ensure that vaccination is a family tradition we pass on with pride to every family so that every generation is protected, because vaccine works, my dear friend. So, this year, we will kick out this misinformation and bring in the real information which is required for immunization. Thank you very much for giving your valuable time. Stay safe.